Okay.
YouTube. And then give me a second to start the recording. I'll give everybody a couple more seconds to get on.
I'm going to mute. Mute.
All right, I'm going to ask everybody to mute themselves. I'm actually going to mute everybody. And then we'll start in just a minute. Jackie, when I mute everybody, it's going to mute you as well. So go ahead and unmute.
Okay.
All right. Thank you, everybody, for coming tonight. My name is Patrick Botts-Forbes. I am the LAFD CERT Central Bureau Coordinator. We also have Christy Adair, who is our Valley Bureau Coordinator. And do we have, we also have, who do we have on here? I saw Jose there. He's our Battalion 4 Coordinator. And well, we have a lot of people on here, so thank you everybody for coming. Of course, we have Jackie Kozak, who is our Battalion 5 Coordinator. She'll be the one presenting tonight and going over medical triage. I do want to say a few words before we get started. This training is really, after the events of the last week, we see how critical it is for the community emergency response team training, how critical it is that you get a better understanding of medical training, either get certified first aid CPR AED or advanced first aid training, because you never know what circumstance you might be in. A tornado could literally come through and devastate your entire town or your place of business, or maybe just your block. And of course, we don't get tornadoes, at least nothing to that level that they did in the Midwest here in Los Angeles, but we don't know what kind of disaster can happen. It can just literally happen. An earthquake can come out of nowhere. And this training makes you a leader in your neighborhood, in your place of business. Could you imagine the panic that people were having as literally the roof is being ripped off the building they're in, and they don't know what to do. They don't know what to do next. I really want to encourage people to take this training seriously, because people will be looking to you, and hopefully this training will allow you to think through what is next so that you're not the one panicking. And when you panic, all sense and sensibility and all planning goes out the window. When you've reached the point where you start to panic, it's a complete failure of everything, and you're completely reactionary. If you can remain calm and understand the flow of what's happening next, you're able to plot a course and think out what you're going to be doing, and then move forward and get out of there alive, and hopefully take people with you. This, of course, as 2021 comes to an end, we have plans for 2022 to ramp up the training that we've been doing. We want to bring our battalion coordinators and our other bureau coordinators in on these monthly trainings, really have them engaged. So it's not just one or two people that you keep seeing over and over again. We have a large number of people who have a lot of experience, a lot of training, and they're used to doing these meetings in their own areas. I want to give them this larger forum. We have 65 people on tonight. In our previous trainings, we've had upwards of 200 people. And I really want to give that opportunity to them to be able to share their knowledge with you and give you different perspectives. I personally have done triage a few times. When Jackie said she wanted to do triage, I said, great, because I want to see how she does it. It challenges me to think differently as well. So I want to encourage everybody to also come say to me, hey, I'm a neighborhood team leader in my area. I'm interested in presenting on this topic, and let's see what we can do to give you that opportunity. You learn so much teaching other people as well. This Saturday is going to be our pop-up drill in the city of Los Angeles. We're rotating these around the city every month. Our last drill was in Venice. The previous one to that was in Mid-City. January's drill is going to be in the harbor area in coastal San Pedro. But for this month, we're going to be in Northeast LA in El Sereno at the Rose Hills Recreation Center, Saturday, December 18th from 9:30 to 12:30 a.m. 9:30 a.m. to 12:30 p.m. And the topic is going to be on incident response. We're focusing on those incident response teams that are going to be doing the good. They're going to be hands-on. They're going to be saving people's lives, bandaging, triaging, putting out small fires, keeping people safe, cautioning off areas that are unsafe. Maybe there's wires down or a hazard in the road. And it's really going to be the core function of what you and your neighborhood disaster response team is going to be doing. So hopefully you can make it out. We will have facilitators going out with you, giving you a story, telling you about the incident, describing it to you, acting it out, and then really engaging with you to work through these incidents. Again, that is this Saturday, December 18th from 9:30 a.m. to 12:30 p.m. at the Rose Hills Recreation Center. I'll post the link in a little bit. Martin, real fast.
I was just going to say, along with the medical and the physical dealing with people out there, there's an emotional or psychological aspect to it. And one of the things that was on the news was a veterans group that came out as volunteers. And when they interviewed the leader, his statement was, "We're out here to find people, and we don't want the people who are experiencing this disaster to be the ones to find their neighbors and their relatives, because that's a lasting trauma on them. We want to be the ones who find them to cushion that impact." And a lot of times we think about the medical, but there really is a psychological aspect to this that is far, far reaching, even after the wounds are healed physically.
Absolutely. And that's one thing that's been requested, and I'm still working on it, to have psychological first aid training. It's not something I've taken. It's definitely not something that I'm capable of teaching. So I want to bring in a subject matter expert on it and put together a really good training for you. Patty.
Yeah, Red Cross at one point, a number of years ago now, had a psychological first aid course, which was quite good. I took it, and you get a little wallet card with a quickie thing on what do you do in that circumstances. And one of the things they had was to how to talk to people when they're in a disaster. They addressed a lot of things that was taught by nurses with the disasters, or pardon me, it's now called the response side of the Red Cross. So you might get into the response side of Red Cross and see if they still have it. I don't know. I'm sure many other places have it as well. Yeah. Is that it? That's the little wallet card? Yeah, great. So they're still doing it. Super.
Great suggestion, Patty. Thanks. All right. Without further ado, Jackie.
Hi, everybody. I'm Jacqueline Kozak. I'm gonna I'll wait to share my screen. So I'll tell you a little bit just quickly about me. I've been a CERT trained member since 2008. Been a battalion coordinator since 2013. I am the one of two battalion coordinators in Hollywood. And the other coordinator is Bob Ajamian, but he has been out of the country. I used to be in EMR, but since COVID, my certificate has lapsed. But I do love teaching triage. Really used to teaching this to a group of people. This is my first time with Zoom, so bear with me. I ask my fellow, coordinators to, if something needs a little bit more oomph, please, chime in, because I'm all for that. Okay, so I'm going to share my screen now, and we're going to take you through triage. Very excited. Okay, all righty, medical triage. The greatest good for the greatest number. Okay. Okay, so we're just going to go through some agenda pieces, and I am a big meme person, so you're going to see a lot of memes in this presentation. But for our tonight's agenda, we're going to review some on scene and scene safety. So kind of size up when you start triage. We're going to look at some of the appropriate PPEs, personal protective equipment. You can't have triage without rapid treatment. So that's the start. Simple triage and rapid treatment. We're going to have a triage intro, the 4 categories that we're tagging them. We're going to review the 3 killers, RPMs. That's how we're assessing our patients when we go into a situation of a mass casualty incident where there's more patients than there are rescuers. We're going to look at the scenario that I have tonight, and then we're going to start triage. And then at the end, we'll compare our patient count that you have. We're gonna do the each patient. You're gonna do it silently to yourself, and then we're gonna come together at the end and just compare and see what you have. And then if you have any questions, I'm happy to answer them, or we could go back to a certain patient if there's anything unclear. Okay, so here we go. Very excited. So keep calm and scene size up. Okay, so your safety is priority. You come across a scene, that's the first thing you want to make sure is that scene is safe for you to enter it. And as much good as you want to do, there's a lot of good-hearted people out there. Scene safety, you really have to think about yourself. My sister once told me about when she saw firefighters running or going up to a house. So they pulled up to a house, and she thought it was funny that no one was running. They weren't running to the house. I guess there was a small fire. And of course they're not running up to a house. They're taking their time. They're very deliberate, and they're not going to get on scene and into whatever they're going to get into, a structure fire, multi-casualty, traffic accident. They're not going to do any of that without sizing up the scene. Okay, so your safety is paramount, the rescuer's safety. There was an incident back in 2013, and I'm sure if you live in LA, you know of it, because somebody was speeding, trying to get to the gym. It was raining, lost control, hit a fire hydrant, and obviously the fire hydrant, streams going 100 feet in the air. A woman called 911, then she went in to help, and she was killed. She got electrocuted. And another woman after that went in, and she was also killed. And then when the husband also tried to help, he wasn't killed, but he felt the electricity. He knew something was up. So really taking in your surroundings. As much as you want to help, you really have to stop and think and look and listen, because you could become just another victim or patient. Okay. Some of the scene, I thought this was an interesting slide, just because it really shows you all of the different possibilities of risk when you're entering a scene. I also thought the Anthropogenic Hazard was very up to date. Now we really do have to worry, is there an active shooter? Is there somebody, it's those that comes with the times. But there are physical hazards, down power lines, There are chemical hazards. You come across, just reading the signs of a truck that's just had an accident. If you come across, a car accident, biological hazards, are people stumbling, not maybe from injury, but are people stumbling about? Are people getting sick? Are there, and is it happening, with person to person you're seeing, is maybe something's, coming out of their mouth. Maybe, you have to take into consideration all of these things. There's also, ergonomic hazards. What are your limitations? It's something we forget about. What can you do? What can you not do? I mean, being honest about that, because if you aren't honest and know what your physical limitations are, I mean, you could also end up a patient going into a scene and trying to help. There's natural hazards like weather. Is there lightning in the air in the area? Does anyone want to come up with other hazards? And maybe Patrick can take off or you can raise your hand and Patrick can take off the mute. Does anyone want to give examples of other hazards?
Well, I have one.
Okay.
A dog loose in the yard that might attack them.
Yeah, absolutely. We had a CERT member who was volunteering at the election, at a polls, and a dog bit him. So absolutely. Anybody else?
We have flash floods.
Flash floods, yes. Maybe even understanding how many inches of rain is pouring per hour,
Or even
How
our
much-
waterways.
Yeah. Yes. Knowing
flow
if
of
there's
water.
absolutely. Anybody else?
Yes,
I would like to say something.
Okay.
I remember that incident where you were talking about. That was so
Yeah.
sad. It was a sad situation because you're trying to help and everybody's trying to help, but you got to look around the surroundings.
You do. And it's
That's very important. You know
yeah.
what? I remember one thing that somebody said, that we're not Superman. We try to save everybody, but we can't, because we have to look at, and because you know what? The people that are trying to help, now we're not vulnerable. What I'm trying to say is that we can be putting our own certain members in. I always say to myself, I'm a military person. Observe
Yeah.
and report. Observe and report, that's the main thing. Don't go in there and try to be Superman, because we cannot save the world. We always try to do our best as certain members, and the community does need us, and I'm working very hard to
Exactly.
come up and become a team leader.
Yeah.
And Patrick
And listen,
knows.
yeah. And listen, if an 8.3 hits and people are crying out for help, but we're not trained. We don't have the equipment to go in heavily damaged buildings, but you hear people scream, you're going to want to go help, but you're going to have to understand that and know what your limitations are in your training and stick to that. Even yesterday in this rainstorm that we had, the LAFD had 3 cars in the LA River, and they couldn't get to them. They were not going to go in. The cars were pinned against one of the beams under a bridge. And Eric Scott, lovely PIO of the LAFD, love him. He said, we looked at the risk assessment and we just can't do it, because they didn't know if there was a person in there, but they felt that it was just too dangerous for the firefighters to go in and try to extricate somebody. Not even knowing if someone was in the car or not. They couldn't even check. The water was moving so fast in the LA River on yesterday. So,
Can I say something, please? I'm not trying to.
Sure.
I agree with you 100% because I seen that too. You know,
Yeah.
the water was moving so fast, and there was I seen
Yeah.
that.
Yeah.
And
You
it
know.
was bad because why are you going to put the fire department in a risk for something because the water moved so fast and so much water coming down? There was a car that was stuck on there. You know,
Yeah.
they
Yeah.
did not go in there because they're going to put the fire department at risk. And you know what? Fire departments, they put their lives in the line.
Exactly. And
That's
Eric
what-
Scott, PIO, he's the professional, you know, he communicated exactly that to the news, and, you know, and that's what they do. That's what they're trained to do, is assess risk, mitigate risk for their firefighters. You know, it's all about risk versus reward. You know, how much risk will you take? Alrighty, thank you. We'll move on a little
Kelly has
bit.
her hand up.
I had one
go
to
ahead.
add to it.
Yes, go ahead. Is that Sally?
Yes, it is.
I recognize your
Glad
voice.
to have you. Good to see you.
Thank
Hey,
you.
listen, I'm just gonna throw in active shooter,
Absolutely.
you know, and just be situational
Yes.
aware because of all the smash and grabs and in malls and stuff. So it's not just shooting, but it's everything.
Absolutely.
Did not notice it in there, but
Yeah, that's the anthropogenic, which is really human action. And they call it the anthropogenic hazard, which is, yeah, human actions that are taking place could be a hazard.
If you're down at the beach, you got to look out for currents and sneaker waves. Every year up here, we have people die because they try to rescue somebody and they wind up drowning themselves.
Absolutely. Absolutely. And, you know, are you able to, are you strong enough to, you know, to even get out there and swim? You got to know your limitations too. So, alrighty, we'll move on if you don't mind, and then we're just gonna just briefly talk about PPEs. I'm sure everyone really, you know, they've got this down, but let's just review. I don't know if anyone has seen these PPEs that were at the beginning of the pandemic. Very creative. This is not what we're going for, really, but you know, in some instances it may work if you're in a bind. Hey, you know, let's see. Okay, so we got our helmet, our goggles, mask, gloves. You can wear your nitrile gloves underneath your work gloves. Hopefully you have this in your car. Maybe even have something at your office, perhaps, and obviously at your house. Maybe not, you know, the full gear of everything. And then hopefully you have sturdy shoes too, because if you come across, you know, a rain slick road and a car accident, multi-casualties, and there's no, you know, you're somewhere, you know, in a rural setting, you know, hopefully you have some sturdy shoes, closed toe shoes also. Okay. Okay, start. Simple triage and rapid treatment. 40% of disaster victims can be saved using this. That 40%, it may be higher, it may be lower. That's directly from the CERT manual. But we're doing simple triage and rapid treatment. Okay, the simple assessments, your RPMs, we're going to get into that. And then your rapid treatment of the injuries for the killers, the 3 killers. Okay. Okay, this is our scenario. We're going to come back to this, but just kind of take a look. I'm not gonna go through everything. We'll go through the hazards in a later slide, but I just want to introduce it to you here. Okay, you've got where you're going to come in from. You've got your patients, and you've got your walking wounded. But you'll just kind of see what you're up against. Okay. So the objective of triage means to sort. You're going to identify the dead and 2 injured to be saved. Send minor injuries to holding areas for treatment and transport. You can also use those minor injuries to help you, because you're going to be one person possibly and you're going to have an MCI. You're going to have more patients than you are rescuers. So you're going to need some help. You're going to need some help from the miners that are able to help you. So you don't want to send them all off to a holding area. But you do want to select, people who can help you, who are volunteering for that. You're also going to identify those life-threatening injuries, those 3 killers, and you're going to treat until help arrives. Okay, so triage is a very dynamic, just because someone gets triaged doesn't mean that they're that category. You're always assessing, but at first, when you first arrive on scene, this is what you want to do. You're going to have to sort them. And this is not where we do CPR, unfortunately. I know sometimes it's very hard for when I'm presenting this class or this presentation, it's very hard for people to wrap their mind around that you're not doing CPR. But CPR is really only meant if you're calling EMS to come, assist you and, restart the heart with a defibrillator. If you start CPR on someone, you'll have to continue that. You can't move on. You can't go to another patient and triage them and treat any of the 3 killers. So keep that in mind.
So what goes in category 3 there?
Sorry, I can't go back. Well, I can go back. So in category 3 that you just saw, it was the life-threatening injuries. You're identifying those and you're treating for those life-threatening injuries.
But what are they?
Well, we're going to review that. We're going to go through this step by step. Okay? Okay. So we're going to triage. Do you have another question?
Just thinking.
Okay. So we're going to triage victims in 4 different categories. Okay. We're going to take this really step by step. So if I'm not presenting it right now, I'm sure we'll get to it. Okay. So we're going to triage victims in 4 different categories. We're immediate or red, minor, green, delayed yellow, and dead black. Now, you could be the ultimate CERT person and have all of this on you at all times, like triage tags, all that. But what other things can you use to identify immediates, minors, delayed, and dead black? I'd like to hear some ideas. You can think out of the box too. So when you're identifying patients, you need to label them. You need to tag them somehow, some way. So can I hear from anyone if you have some ideas for us?
Well, you can use yarn.
Yeah.
Rubber bands.
A rubber
And
band.
lights.
Okay.
Colored,
Templates are good.
colored duct tape.
Colored duct tape. Yep.
Lipstick, eyeshadow, any makeup. You could also use blood.
A magic marker and put the initial immediate IMD or dead on their forehead.
Yes. Okay.
Excuse me, can I say something?
Yes.
It's not good to put anything on the forehead, because I've been in a couple of meetings, and it's not good to put it on their forehead and write it in their forehead, because as they start sweating and they're going into all this thing, they're going to be wiping themselves. They're not in the right mind. Put it on the
That's
forehead.
a good point.
No, I went to a meeting to this, and that was one thing that I brought up, and I was always thinking about that. It's not
Okay.
good.
So where else can they put it?
Well, you got the tags. You got all the tags. Just tag them up and put in all that. Somebody even said, "What are you gonna do with a dead person? What is their name? Can I go in their pocket?" I don't know. Nobody brought that up.
Well, we're talking about triage right now, so none of that's happening at this point because triage is rapid. You're gonna do. You have like 30 seconds to go to each person. Okay.
I just want to
tag
say,
them.
not a good idea to put it on their forehead.
So,
Right.
Use
Yes,
their
thank
forearm.
you very much. I'm sorry.
Patrick, can you kind of, or Christy, you know, kind of give us your
Joy has
opinion on
her, oh, opinion.
not opinion, but yeah, your say, what
I'll let
your
Christy go.
recommendation?
I think historically, people used to put in Sharpie on people's foreheads, but the problem is the initial triage is sometimes incorrect. And so what generally happens is the field teams will do the initial triage and mark the patients, then they get reassessed at the field treatment area. So a permanent marker on someone's forehead isn't really good in case that changes. They might, get worse.
Yeah,
So
that's a good point.
there is masking tape that you could put on a clothing, or masking tape you could put on a wrist, or just some kind of marker. But the thing is, you need to be consistent where you place it on the person, and how you do it so that people recognize your signals. So don't put a piece of tape around someone's neck and then put it around someone else's wrist. So try to be consistent with how you mark, because I mean, moving very quickly and looking all over the body for, it's on the ankle now. Where you decide to stick it, be consistent with the colors. And if you just forget the colors, and a lot of people have problems with colors, just spell out IMED or DEL or, X for dead, but just be consistent.
And if you're working with a team, make sure that your team agrees upon what you're going to be doing and how you're going to signal. If you're going to be doing something on everyone's left hand, everybody knows it's always everyone's left hand, so that you are consistent across the team. I do like what Carolyn suggested, and it's those party wristbands, like when you go to the ones that are difficult to rip off. Those are rather cheap, and you can buy them online, and you can get them in any color you want and in any pattern. So you could always have those on you or in your bag.
Yeah, or in your car. Yeah, you're absolutely right. And they lock on. They kind of lock. Yeah, they're really very
Joy
useful.
has her hand up. Joy, do you want to unmute yourself?
Yeah, thank you. I did, and everyone started calling out with the same things I would have said. So doesn't matter now because they've been said. Thank you.
Thank you, Joy.
And Patty?
Yeah, I was taught that you draw a point from the shoulders, draw a line to the center, and it's slightly less than mid-chest. And that's where you would put your tape and your identification of whatever they are, because the forehead does get sweaty and sometimes gets wiped off or is not visible because of injuries, etc.
Thank you, Patty. Okay. Alrighty, so triage, the immediate. This is one of the tags. Okay, these are your life-threatening injuries. They have to deal with airway, bleeding, and shock. And we're going to get more into this. I just want to just review it here. Immediate attention is needed to save this life. And these patients are marked red. Your minor, these are your walking wounded. Like I said, they can be used to help you. You're going to need them. If you're by yourself and you have an MCI in front of you and you're in a rural area, or help is not coming immediately, you are going to need the walking wounded. And how do we get them? How do we know who's the walking wounded?
They're walking.
Right. Right.
Ask.
You call out and you ask everybody that can hear my voice, walk this way.
Exactly. Because they could be walking around, kind of, confused. They don't know what to do. But yes, you are giving them an instruction to walk towards you. Okay. They're able to follow that instruction, that command, and they're going to walk towards you. Okay. You're going to want to find, you're also going to, if there are other bystanders, you're going to want to elicit their help also. And if you are putting the minor in a treatment area, the ones that are not able to help you, you want to make sure that it is in a safe place away from the actual incident. Okay.
Yeah, Jacqueline,
Yes.
hi. Could I ask a favor? Could you avoid acronyms like PMS and MCI? And
Yes.
I have no idea what these mean.
Yes. So yeah, I'm sorry. MCI is a multi-casualty incident. Yeah. Sorry. Thank you for bringing that to my attention. Okay. So you're delayed. So these are not the walking wounded, because they did not get up at the sound of your voice and walk towards you. Okay. They may not be immediate. They may have some other injury that keeps them from getting up. And these people are delayed. Treatment may be required, but there's no jeopardy in their airway. There's no excessive bleeding, and they're able to follow commands. Okay, these patients are marked yellow. So dead, black. There's no respiration after 2 attempts. So for you're doing the chin tilt, and you have no respiration after 2 attempts. They would be considered dead. CPR is not performed on these people. It's something you just have to wrap your mind around. I mean, hopefully, none of us are in that situation, but if you are, just know that this is when there are more patients than there are rescuers. Your job is to sort the patients, so when help does come, that they're going to be treated and transported based on priority and their injuries. And that's really why you're tagging them. So when help does arrive, they're gonna be able to sort those patients and identify who needs to be treated and transported first. So we're treating the 3 killers as we're doing triage. You're doing this simultaneously. You may even walk up to a person, and as you're assessing them, and you're immediately controlling the bleeding that you see before you even start the RPMs. And we'll get into RPMs. But if you do not treat the 3 killers, most likely it'll lead to their death. Remember, the 3 killers are airway obstruction, controlled excessive bleeding, and shock. So we need to maintain, killer 1, maintain an airway. Okay. We're going to do this. I'd like to just hand it to you guys. How are you going to maintain an airway when you are the only one doing the triage? And how would you maintain an airway for somebody if there's no one to help you?
Put something under their neck to keep their head.
No.
Yep.
Yeah.
Okay. Absolutely.
You'd put something underneath their shoulders, not the neck, in case there's a potential neck injury. It would be less traumatic if it's between the shoulder blades, and it opens the airway automatically.
And ask them.
Okay. Pardon me?
If you could enlist one of the walking wounded minor patients to help to hold the pressure.
Absolutely. Because if you're going to do a head tilt chin lift, if you don't have anything readily available to prop up their shoulders, you're going to need someone to physically do it and keep that airway open. Okay. Because people who are unconscious, they have a tendency, I don't know the anatomical reason why it happened. I think your tongue just gets really relaxed, and it can block that, block air from coming in. Okay, that's killer 1. Killer 2, control bleeding. So a number of different ways we can control bleeding. We can do direct pressure on the wound. What can you use for, obviously our goal is to have something sterile, but what can you use for direct pressure? Because you want to use some kind of, you could use your hand, but
you could tear a piece of clothing.
Yeah. Yeah.
Scarf tie.
And whose clothing would you tear?
The patient's.
The patient's.
Yeah. T-shirt.
Yeah. Yep. Okay. And could the walking, go ahead.
I was gonna say gauze, abdominal pads, compression bandages.
Yeah, if you have those, yeah. Yeah. If you are stocked and you have that, you got your medical bag with you, absolutely. And then who could help hold it? One of the walking wounded, right? Maybe even the patient themselves, if they're conscious, why not? Okay.
You can also use sanitary pads. You can use 4x4s. You can use any kind of fabric.
Yes. Preferably, something that's, sterile, but you may not have that. You may not have that. We may not have that luxury in the time that we come across something like this. Okay, we do elevation. We can elevate. If they're unconscious, though, who's gonna hold that arm up? Maybe one of your walking wounded. Again, maybe one of the bystanders. You're gonna elicit help from people because people want to help, and that's what's so amazing about this is, and that's why we get trained, is because we want to help and we want to make a difference, but people showing up and bystanders and people are going to want to help. So if you can give them direction, that's awesome. So pressure bandage. Now that this is on here, but I think it's a little bit too soon. Maybe one of your walking wounded just happens to be, a nurse or something, and they could put a pressure bandage on, or, but pressure bandage is more at the time of treatment. I noticed that a little too late. So that's when they actually go to treatment, when you get everyone triaged. I don't know if I wouldn't take the time in triage to pressure bandage somebody. It's about controlling it in other ways, and direct pressure. You can also do pressure points, the brachial artery for bleeding of the upper limb, the femoral.
What about tourniquets?
The pressure bandage on in less than a minute if you know what you're doing.
If you know what you're doing, absolutely. But triage is 30 seconds or less, right? I mean, triage is about, getting to sort and treat as many patients as you can.
Now, my understanding was there's no treatment during triage. It's just.
Well, you have to, the 3 killers. You have to treat the 3 killers. You have to. That's part of it.
Treatment is probably not the correct term here. It's stopping life threats.
Yeah, it's rapid treatment. We'll start as rapid treatment, but yeah, it's, it's stopping the 3 killers, because they will, if they have an issue with any of the airway, the bleeding, the perfusion, or shock, they're definitely, they could die without help.
Martin has his hand up.
Jackie?
Yes.
As part of your PPE repertoire, you should always carry multiple sets of gloves with you, because if you're going to ask the general public in this day and age, people are going to be very much concerned whenever there's any type of blood flowing as
absolutely
catching something.
Absolutely.
So if you've got extra sets with you and they're portioned out, maybe in Ziploc baggies or something, if you can get somebody to help you out, just toss them the baggie, ask them to put it on for their protection. And you're more likely to get someone that'll help you under those circumstances.
Absolutely. I agree 100% there, you know, and hopefully we have them, you know, hopefully we have them on us, you know, and hopefully you have some willing bystanders and participants who want to help. But you never know. I mean, you just don't know. But your job is to really get through, you know, do the greater good for the greatest number. Okay. Thank you, Martin. Okay, treat for shock. So we're going to treat for shock. I don't know why it says 12 inches. I don't know if that's necessarily, but we're going to maintain, we want to first maintain the body temperature. So giving them a blanket, a jacket, you know, treat for shock. I would almost put every person that has an immediate in if you can, treat them for shock while you're doing the 3 killers, the rapid treatment, I should say. Elevate the feet, no food or drink, and no rough handling. So, and I always, I'm going to just look at the definition for shock, because I always, it can happen on any, from airway, from excessive bleeding. Give me 1 second.
While you're doing that, Jackie, the whole purpose of this exercise is to keep the person from going into shock. So like you said, the airway, if they can't breathe, they're not getting enough oxygen. So
right.
So they'll go into shock. If they're losing all their blood, they'll go into shock. And if they get to the point where they're confused.
Yeah, thank you, Carolyn. Okay. Okay, so how do we assess each patient?
Hi, Jacqueline,
Okay,
question.
Yeah, yes.
In the 2 slides ago, where's the temporal and facial arteries?
Oh, yeah.
Let's see. It's hard for me to get back for some reason. Let's see.
You should be able to use your arrow keys to go back. If you hit the left
Yeah,
arrow.
so on this slide, under C, pressure points.
Oh gosh, see.
You need to select from current.
Yeah. So your temporal is right. Go ahead.
No, please. I was just directing you to the question point under C, pressure points.
Yeah.
The temporal
so
and facial.
Your carotid is in your neck. Your temporal is by your temples, and then your facial is, you know what, I saw a picture of it. Can anyone help me out here? I think it's on the side of your face, just below your chin.
This is the temporal.
And the brachial artery is right inside your elbow where you take your pulse.
Yeah, so you see where his fingers are squeezing, and the femoral is the top of the thigh.
Yeah, but the brachial is not all the way up at under your armpit. The brachial is closer to your elbow.
Actually, the femoral artery is in the groin. The pressure point is in the groin because the femoral artery goes over the head of the humerus, or the head of the femur. So
Correct.
that's right in the groin, and you can lay on your bed and feel that at night. You can feel the pulse point, so you know exactly where it is. And on brachial, it's on the front. When the arm's up at a 90-degree angle, it's about halfway in between the joints, the elbow and the shoulder.
Okay, so this picture depicts it more near the armpit.
That's
because of where the injury is.
Yeah. Yeah.
Here's the facial.
Angela has her hand up.
Okay.
Sorry, Patrick, I forgot to take it down.
Okay.
Thank you.
Okay.
Jackie, you were gonna look for the definition of shock here?
Yes, thank you.
So this is Christy. I'm actually, oh, sorry. I thought while you were looking this up,
Oh, go ahead.
I Googled facial artery and it looks like it's a vein, a thick vein that extends off of the carotid artery and it goes up towards the front of the face and it goes up behind the neck. I think if you Google, I've never heard of the facial artery or the temporal artery. So
Yeah, I hadn't
question.
heard.
So
Yeah.
I'm looking those up. I'm just,
Thank you.
thank you.
So,
So, go ahead, Jackie, and I'll step.
no, go ahead, Patrick. What's up?
On pressure points, EMT has taken out pressure points for this exact reason. We just spent several minutes discussing where the pressure points are. The pictures are not great. This is not used by EMTs anymore, but it is still taught by CERT. So
Yeah.
don't spend an enormous amount of time trying to figure out where the pressure point is, because you might
Yeah.
I have a question.
Especially we don't do these things every day. This is not my job. I don't use any of these skills, and you have to use these skills in order to, to perform them, perfectly. I mean, we don't rise to the occasion. We sink to our lowest level of training. Right.
If you have a tourniquet in your pack, can you take the time to put it on or you don't?
Well, the thing with tourniquet is you don't always want to apply a tourniquet unless it's absolutely necessary because you want to keep the blood flow going. So there are ways to make a makeshift tourniquet that would apply the same amount of pressure but won't actually stop the full blood flow, but will stop the bleeding when you're actually bleeding. And here's a tourniquet if anyone wants to see it.
Excuse me, can I say something, please? Hello?
Yeah, go for it.
Okay, putting a tourniquet, if you put a tourniquet in your leg, you know what's going to happen after you put a tourniquet, you're going to lose the blood flow and happily. If you put a tourniquet on a person, on a leg or anything, you're going to stop the blood flow. Putting a tourniquet on somebody they're going to lose their leg because the cartridge, maybe their bone might be sticking out. You put a tourniquet on everybody, 99 out of 100, and you start the blood pressure, and it's not a good idea because if you put a tourniquet, you got to be very careful of putting a tourniquet on the person.
Mm-hmm.
That's not the modern teaching anymore. We're talking about if someone is spurting blood from a leg injury, they will die in minutes if you do not stop the blood flow from.
I'm sorry, Patrick. I just wanted to say putting a tourniquet on the person is not very good because they're going to lose their leg. You might want
to. But I think I think that all changed with just the active shooter and all that. I think they have incorporated that. I've never done a tourniquet. I would never. I don't teach it because I've never held one. I've never done that. So
Tourniquets will get removed by a surgeon at the hospital, and they can be on for upwards of many hours before someone is losing their life.
Make sure you also mark the time.
Everybody mute themselves. Someone is really making a lot of noise. Jackie, let's get back to the definition of shock, and then let's continue on.
Okay, so shock is a condition that occurs when the body is not getting enough blood flow. When the blood doesn't circulate, oxygen and other nutrients are not carried to tissues and organs. Blood vessels begin to close and organs are damaged, and if left untreated, will shut down completely, which could lead to death, obviously.
I just want to tangent off that or expand upon that real fast. Most people in a traumatic incident will go into shock.
Yeah.
So treating for shock is not so much preventing them from going into shock, it's helping the body stay alive longer while the body is already in danger of, it is in shock.
Right.
So this is why you're keeping it warm, because the blood is being pulled away from the skin and starting to cool. You do want to place something underneath them as well, because if somebody's laying on the ground will leach heat away from them.
Exactly.
And then by lifting their legs, you're helping blood stay towards the core of the body.
Yeah.
All right. Back to you.
Okay, moving on here. Okay, so how do we assess each patient? So we've got our tags, right? We know what the 3 killers are. Okay, so how are we going to assess them? What are we using? We're using the RPM. The RPMs: respiration, perfusion, and mental status. These are all 3 things that we're going to assess in 30 seconds or less for each patient. Okay. So respiration. So this is, you come upon a scene, you've commanded or commanded all the minor out. You have some minor helping you with this, and you start where you stand. And the first step 1 is assess the breathing. Okay, so you're going to check the breathing rate. Now, it's not something you're not going to have time to start looking at your watch and counting their breaths. You're going to have to really take in. You're going to have to look at it from kind of like the big picture. You're looking, you're listening, you're feeling. Okay, so if they're breathing over 30 breaths per minute, you're going to know it. You're going to see it. You're going to hear it. Okay, this is very pronounced breathing. So anything over 30 breaths, if they're talking to you, having a normal conversation, I would, that would be less than 30 breaths. If they're answering, if you come up to them, hey, my name is Jacqueline, I'm want to just do a quick triage, and they're able to answer you, right away you're going to step 2 because their breathing is not affected. Okay, their breathing is normal. Okay, so if it's greater than 30, though, you are immediately tagging them red, and you're treating the 3 killers. If you see anything that is, you have excessive bleeding, or you have, their airway is, they're not able to keep their airway open, or they're unconscious. I would always treat them for shock. I would almost put every person you come into doing a triage is put them into shock. Treat them for shock, because like Patrick said, most of them are probably you going into shock, or possibly heading there. You want to keep them warm. You want to elevate their feet. No rough handling, no food, no drink. So once you tag them immediate, you're going to move on to the next patient. Okay, you have that patient, you've already tagged them. You have one of your minors, with them, keeping an airway open, maybe even treating them for shock, getting them, raising their feet as you move on to the next patient. Okay, so you're not even going to perfusion and mental status. You have identified that they are immediate, and you are going on to the next patient. So if there's no breath after 2 attempts, you do tag them dead or black, If they're below 30 breaths per minute and they're talking to you, they're having a normal conversation, you are moving on to the second assessment of the same patient. You're moving on to perfusion. Okay, so you're going to control visible bleeding immediately. This is another thing. You're going to come upon them, and you may see excessive bleeding. You're going to want to apply pressure. Either the patient does it or a minor, but you're going to control bleeding, and you want to check to see if that bleeding is causing them to be tagged immediate. And you do that by the Blanche test using the capillary refill on your finger or on the inside of your palm if they're wearing nail polish. But you hold the tip of the finger down and you release, and if within 2 seconds it does not refill, you tag them immediate. Okay? You treat for the 3 killers and you move on to the next patient. Again, treating for the 3 killers, making sure they have an open airway, making sure we've controlled bleeding, and treating them for shock. If it's 2 seconds or less, you move on to step 3. So that means if you're moving on to step 3 with the same patient, that means they've passed the respiration and the perfusion, and now we're going into mental status. This is your step 3. This is the same patient. So you're going to ask them to follow simple commands, and we'll just keep it going. But I'll, some simple commands. I mean, you don't want to ask them their name because you don't know their name. You're going to want to ask them, who's the president? You can hold out your hand and see if they go to shake it. The universal, language for, reaching out and shaking someone's hand. Well, if you want to give me some other examples, we can just take a couple, because we have a lot to get through still. A couple ideas on what you can do to see if they can follow simple commands.
What city
Now,
are you?
please don't ask him who's the president.
Oh, no? Oh,
Yeah, you might get different answers nowadays.
What city are you in?
Here's one that I've actually heard the fire department say to my sister: is Mickey Mouse a dog or a cat?
Oh. Yeah, neither. I had to think about that for a minute.
Yeah, see, and it gets people to think. So, it really shows awareness there.
Yeah, that's a good one.
Good.
What color am I wearing?
They could be colorblind, though.
Could you ask them something simple like how much is 1 and 1?
What day of the week is it?
They know what happened. You can ask if they know what happened to them.
Yeah.
First off, the day of the week is not a good one because 9 times out of 10, most people don't even know what it is on a good day.
That's
How many days are in a week?
How many fingers do I have up?
Yeah. But what if they're blind? What if they're, you may not know that right away.
Where are you?
If it wasn't a traumatic incident, they may not know what happened, especially if they were in a vehicle crash and just flipped over. They might not know what exactly happened.
Squeeze my hand.
Squeeze my hand. That's a good one. Yeah. So so if they aren't, go ahead.
I would. And what about if they're deaf? They can't hear, and they're deaf, and you're trying to make. I know sign language.
Right.
What about if you get to someone that don't know how to talk and you respond and you tell him he doesn't know nothing?
Well, yeah, I think
that's a very important situation.
Absolutely. Absolutely. You have to be aware. You have to be aware.
Yes.
Kind of like Jackie was saying earlier, when you put out your hand, the international, hey, let me shake your hand type thing, that's almost, that would cover that.
Yeah. Even maybe taking their hand and squeezing it, like if they indicate to you that they're deaf, that they can't hear, maybe even squeezing their hand, and then having them,
well, there was hold on, hold on. I'm not trying to be rude or nothing, but there was one thing when I went into a meeting. Okay, you got that, and I'm not trying to be nothing, but what happens if a girl puts black fingernails and you look into it and it is not going to do like that?
I didn't understand the question. I'm sorry.
2 seconds for you can see where it's coming. If within 2 seconds, if it doesn't come white, then there's a problem, because I mean they're
talking about the blanch test.
Sorry,
oh, okay. I think that was the perfusion. We're on to mental status now. Yeah.
Okay, I'm gonna sorry for saying by just speaking up. I'm sorry.
No, that's okay. Hey, it takes a village, right? It takes a village. So inability to follow commands, they're going to tag them red, and you're going to treat them for shock. And then you move on to the next patient. Now, if they can follow commands and they've passed the respiration and the perfusion, they're tagged yellow, delayed. They're not minor because they didn't walk toward the sound of your voice, right? So these are your delayed and yellow. Okay. Now, are there any questions before? This is a lot of information before moving on into the scenario.
Jackie, the one question I have, which was slightly brought up just now, is if you're calling out to people that are in a casualty situation to come to you, and you have people who are deaf they won't necessarily come to you because they won't hear the command or the request.
Right.
So you may be dealing with walking wounded that you're now looking at triaging, but actually they are okay. They just don't hear you. So you have to
Absolutely. 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 You know, I would still delay, you know, mark them delayed, you know, unless you have someone who's, you know, taking them to the minor, you know, but yeah, I don't know. What do you think about that, Carolyn? If someone's deaf and they didn't come to you when you ask them to, you know, come to the sound of your voice.
If they're with somebody, they would know that they were deaf, and they would probably indicate to them to go walking. And if they did, just treat them as yellow. If they don't,
yeah.
Well, that was my question. Did they sustain the injury during the accident or whatever? That's what you'd have to assess.
Right. And that's something for, that's not our job in triage, is to, that would be.
Well, just a quick one. You can see maybe if there's bleeding from the ear or something, and that's why they didn't hear you or something.
Absolutely.
And
Absolutely.
also the victim could have been separated from the people they were with. If they were also blind, then they could look like they're in confusion when they certainly may. Yeah.
Yeah, absolutely. All those scenarios could happen. Go ahead, Patrick.
For deaf people, I think if you were to talk to someone who's deaf and they were coherent, they would indicate to you that they are deaf. I would think so. And if a deaf person sees a bunch of people getting up and walking out, they would probably also try to as well, I would think. So I wouldn't rule out that just because they're deaf, that's going to necessitate an extra complexity.
Right. How do you deal with a parent and child together if one of them maybe is injured and the other one isn't?
Keep the parent with the child, never separate them.
Can I say something, Patrick? Thank you very much for saying that, because my brother is deaf, and I know how to talk to people that are deaf. There's sign languages and movings and stuff, but you know when you're trying to talk to somebody and it's an emergency, they don't know this person is lost. He don't know who's he going to talk to. He can't talk. He's deaf. That's what I want to say for the deaf people. I think we should be working on this and getting more control with the deaf people and having somebody when we have our classes to reach out for the people that are deaf. You know?
Yeah, I think we have. We've drilled. Yeah.
It's
a great idea, Johnny, but let's move on and focus.
Okay, I'm sorry. I apologize. I just thought it was a good comment that
it is, but we can discuss it after.
Okay, I'm gonna mute myself. Sorry.
Thank you. Okay, so 32 RPMs, 32 can do. So this is a good way to remember it when you go into a triage. 32 can do. So you're looking for respiration under 30, less than 30 breaths per minute. You're looking for a cap fill that's under 2 seconds. And you're looking to see if they can if they can follow commands. Okay. All righty. I don't know about you, but I will find you and triage you. Okay, so let's get to our scenario. I love PowerPoint. I swear to God, I had so much fun making this thing. Okay, so we're gonna just kind of review this here. Can people point out some hazards here?
Down power lines.
Down power. Yeah, you like the copy and paste. You like
Possible
that?
fuel leak.
Possible, sure. If maybe you smell it in the air, absolutely. Looking for that. Okay.
Your bus on unstable ground, you have a potential for that bus to move if you get on it or near it.
Absolutely.
Excuse me, where are these hazards marked? Are the hazards marked by numbers?
No, those are your patients. We're gonna get to that.
It looks like the bus is in
Your
water.
patients are so I'm just kind of surveying, take a big picture view. When you come on, you're gonna kind of look at this. Now it's also on a main street.
The highway, yeah.
Yeah.
I was gonna say the highway behind it.
But the
Broken,
bus-
broken glass.
If it starts raining any harder, you could have a flash flood.
Right, the
Yeah,
bus is gonna
there,
flood.
yes, really good point.
You
Really
have
good
a-
point.
You have a
Actually, water-
slope.
There's already water there. You can see the reflection
Thank you.
from the bus in the water.
You have a
Yeah.
steep slope of slippery glass.
If
Difficult-
it's flowing water, you can have a water buildup, almost like a dam on one side, which can push and move things.
You've got difficult footing right from the beginning.
Absolutely. You're on an incline. So, even knowing your own limitations too.
The bus
Okay.
door against the wall, so it may not open.
Right.
Can I say
Okay.
something?
Yes.
I'm looking at this thing. The first thing I'm gonna do, I'm gonna go to the back of that bus and open the emergency door. Every school bus has an emergency door on the side.
Not.
There's also two on top.
Side, the left and the right. Thank
So
you.
we're going to take this step by step, Johnny, if you don't mind. We're going to, so there are a lot of possibilities. Okay. But we want to focus on our training in triage. Okay. So now, would you go on that bus? I mean, would you go on that bus?
No.
I
Well, it
would
looks
not.
like there's only 3 in there and the rest are all strewn about.
Yeah.
I just want to reemphasize what Jacqueline is saying. Before you do anything, you assess the situation and identify the hazards.
Yeah.
Do
I mean, look at
something
the-
before you do that, you may end up hurting yourself and being unable to help.
Exactly. You get on that bus, and what if it tips more? And you're on it now. Now you're a patient. Now you need rescuing. Okay. Even those power lines, they could be touching the water. I don't know if they're electrified.
Well, even
No
if
idea.
they're not, Jacqueline, you've got a lot of moisture down. It looks like it's been raining. The grass looks wet. The streets look wet. So if your wires are live and they're down in the street or on that grass, you could be transmitting electricity to that bus just across the wet surface.
Good practice is always assume the power lines are live. The fire department always do that. They get 3 times confirmation that it's down and off by the DWP before they even, take a chance. So
Absolutely. So for this scenario, let's not have that. And maybe I threw in the electrical power lines, because that could make this whole situation where you stop and don't do anything. I mean, really could, so keep that in
There are
mind.
power lines. If there's,
Yeah.
in that situation, if there are power lines placed where you put them,
Yeah.
nobody should be doing anything, going anywhere near that place.
So let's, for argument's sake, for this, let's take out that scenario, because I do want you to get through these 11 patients, and we're going to take these one by one, okay? Because really, if that whole area is electrified, no one's going in, and all you would do is stop people from going into that scene because it's unsafe, right? But if you see the walking wounded, they're obviously walking around. You may even take your cues from them if they're fine walking around, but you have no idea where the electricity has traveled if that grass is wet, and you have no idea. You could get them out, by asking them to come to the sound of your voice, walk toward the sound of your voice, right? Okay, so these are the details of the crash, okay? So it's midweek, mid-morning, I-10 East, 30 miles east of Blythe, California. This is rural, very rural. They sometimes have these canals that go under the freeway. Probably not even what you call it, but they do have these. And they're actually more perpendicular. But for this case, it's going to be parallel to the freeway. There's light traffic. You're the first on the scene. So you come across it, you see some teens. I don't know why my little X marks are all over the place. You see some teens are walking around. Some teens have been ejected from the bus. And you see teens trapped in the bus, in the front of the bus, near the driver's seat. There's screams and cries of help can be heard from all of them. Okay, they're all asking for your help. And you're one person. So we're going to start here. You start where you stand. We're going to take out the electrified poles for this because I want you to get through these, okay? So what's your first priority? What is your first priority entering this scene?
Check around yourself, just check around.
Get the walking wounded out of there.
Can I safely enter the scene? Maybe I'm walking with a
Yep.
cane myself.
Absolutely. Know your limitations. Absolutely. Your priority number one is your safety. Number one. Not these teens, not these kids, not you know, it's hard to say that, but it's not. You're the priority, okay? We already reviewed what all the hazards are, okay, but we're taking out the power lines because we want to get through this. You got to know your limitations. Remember, this is on a steep bank. Okay, do you have a bad back? Do you have bad knees? You know, do you walk with a cane? You know, what are your limitations? So what's your first triage action? Go ahead. Sorry.
Jackie?
Yes?
All of your patients that are outside the bus apparently were thrown out. So you have to assume that they have neck or spinal injuries. So you're not going to be able to move them very easily without stabilizing them. Number 8 is in the most critical situation because they're in water. And
So let's not jump ahead. We're going to take this one by one. And here's the thing. We are triaging them, right? We're not diagnosing spinal injuries. We are triaging them. Okay? So where do you start? You start where you stand. You don't go to the loudest. Let's say 9 is the loudest, screaming for help. You know, you start where you stand. And that's what firefighters do when they come on, the paramedics come on. They start where they stand. Okay, so number 2 looks like the first place they're going to start. So we've asked for our walking wounded to come to the sound of our voice, right? Okay. So now our walking wounded are up there. They're also, let's just imagine they're helping you as we're going through these patients. Okay. We are going to go through these patients 1 through 11. But just know number 2 would probably be the first place you would start. Okay. So here's what I want to do because I think it'll take too long. We're just going to go through these. You are going to tally. You're going to do your own work. Okay. And you're going to tally what you've tagged them. And then we're going to compare at the end. And then if you have any questions at the end, we'll revisit a slide or, you know, we'll talk about it. Okay. I'm not a paramedic. I do my best on these. I'm not an EMT. So, you know, if I can learn something, please, you know, feel free to teach me. So let's take patient 1. Okay. We're not gonna talk about this. You're just going to look at this and you're going to tag them and you're gonna name the killer that you are treating them for of the 3 killers. Okay, this is a male teen, fractured leg, the bone is exposed, the respiration is less than 30, and the perfusion is greater than 2 seconds. And I'll just take a moment before I move on. Just keep your answers to yourself, and we'll compare at the end. Okay. Okay, I'm going to move on. Okay, so see where patient 2 is. Patient 2 is a female teen, breathing, unconscious. Okay. See where patient 3 is near the bus? 50-year-old female. Who will this be? The driver, yeah, possibly, or a parent. No visible trauma. Their respiration's greater than 30, and they're speaking incoherently. Patient 4, see where they are? Teen female, bruising around the eyes, conscious, respiration less than 30. Can't determine perfusion because of black nail polish. We've already said that you can use the palm of their hand to do a cap refill. Can't follow commands, and their perfusion is greater than 2. Okay, patient 5. We're going to take this 5, 6, and 7. Okay, so 5, 6, and 7. Are you getting on that bus? I don't think so.
Nope.
No. Okay, so there's one that's conscious, quiet. Patient 5 is unconscious. Female is calm, communicating that she has no injuries, is able to follow commands. But she didn't get up off that bus when you asked her to come to the sound of your voice. So she would be delayed. But you're not going to be able to tag them or assess them or even treat them, rapid treat them for the 3 killers. Okay. Patient 8 is in the water, face down. So you're not going to be able to assess because you don't know you don't know how deep that water is. You just don't know what's in that water. I wouldn't get in that water. There could be fuel in that water. So you don't know if this person's dead. Obviously, if they're face down, you may be able to assume, but you're not going to be able to assess them. Okay, patient 9, teen male, unconscious, no visible injuries, and not breathing. Patient 10, female 30s, pregnant, in middle of heavy labor. No visible injuries or bleeding. I should put she's able to follow commands. Sorry. Okay, and then patient 11. Patient 11 is a male teen. He's standing in the canal. He has a severe arm laceration exposing bone. He has a respiration of less than 30. Perfusion is unknown because, well, you just can't really get to him where he is. He is able to follow commands. Okay, does anyone need to go back to anything?
Number 9.
Beginning.
Where?
Number 9.
Number 9, okay. You good?
Uh-huh. Thank you.
Uh-huh. Anyone else? Okay, so what do you got? How many immediates? How about Sally? What do you have?
1, 2, 3, 4, 5 immediates. Number 1, number 2, number 3, number 4. I have all immediates. 5, 6, and 7, we don't know. Number 8 is immediate.
So you have 6 immediates or no 5?
1, 2, 3, 4, 5.
Okay. Any delayed?
Yes. Would be 10 and 11.
So 2. Okay. Any
And
dead?
Number 9.
Still 1. Okay. Anyone else want to share? And please say your name.
Carol,
Pardon me?
Carolyn, I'm saying my name.
Oh, Carolyn, go. Okay, what do you got, honey?
We have 3, 4 people on the other side of the water. How could you get to them to assess them? You would have to cross the water.
Right. Well, actually, you have a little bridge right up there. You see a grassy knoll.
A bridge?
There's like a little grassy knoll up here. Can you see it to the right, above the canal?
Yeah, I do see it. Uh-huh.
Okay. Yeah. So how many immediates do you have, honey?
1, 2, 3, 4, 5, 6.
6 immediates.
1, 2,
Delayed?
1, 2, 3, 4 delayed.
4 delayed? Any dead?
1 dead.
1 dead. Okay. How about one more person? And we're going to see who's got the winning number.
Yeah, I can go.
Okay, go ahead. What's your name?
Philip.
Philip, okay.
So I have 4 red, which is 3, 4, 5, and 10. Then
okay.
Yellow is also 4, 1, 2. Let's see, 1, 2, 6. Oh no, wait. 1, 2, 6, 7, and 11. So that's, let's see, this one, I think that's 5. And then 8 and 9 appear to be dead.
So you have 2 dead, you have 4 delayed and 2 dead, and 4 immediates.
I think it was 5 immediate. Those were 3, 4, 5. Let's see, 10. Yeah, 3, 4, 5, and 10. I guess are the red. So that's 4.
Okay, so 1. So there's 11. So okay, 4. Okay, there's 11 patients though. Okay, all righty. Okay, do you want to see what I got? Maybe I didn't get it right. So 17 patients total, right? So I got 5 immediate, 1 dead, 1 delayed, 6 minor, and 4 unknown.
Where'd you get 17 patients? There were 11.
The walking around.
Minor. The minor. Your minor.
The walking wounded?
Sorry.
How many people were on the bus?
Jacqueline?
You don't
Jacqueline?
know. You don't know. Yeah.
Hi, wouldn't it be greater benefit to specifically go over each patient and decide how it was done rather than having a count?
Oh, that's what, yeah, we're gonna review. That's what I said, you guys, we can review the patients together, but I just wanted you guys to do it on your own and then we'll go back and review. Okay.
Can I ask 2 questions?
That's teaching.
Go ahead.
So the first thing when you get there, I know you want to get going, but should you call 911 first and announce if there's been a problem out
Yes,
there?
you should. absolutely. I missed that one. Thank you for bringing that to my attention.
And then-
Absolutely. You
And then
need,
second, oh, go ahead. Sorry.
yeah, go ahead. No, go ahead.
And did you say the woman on the bus could talk?
There was one woman who was on the bus.
So could you ask her to see if she could talk to anybody else on the bus to see if they at least respond to her? I mean, you can't ask her to do any of the real tests, but you could at least see if anybody was lucid.
You don't know what her, I wouldn't necessarily have them do anything. And maybe Christy, Carolyn, Patrick, you want to try, they're one of the patients. Because I can't physically go up to them and assess them using RPMs, they're saying they're okay, but we don't know that.
Let's go through, and then when we get to that person, we can discuss
Yeah.
this briefly.
But I have one very important point to make.
Yes, go ahead.
Where is your buddy? If you're the only person doing the rescue, you didn't have any business triaging anybody.
Yeah, I know. You know what? I ran out of X's.
You do what you can. You do what you can with the amount of
Right.
resources you have. If
Yeah.
you don't have
Yeah.
any resources, then you make a decision. Is this safe for me to go near this? Do anything? If you decide it is, then do what you can.
Yeah. Okay. So we have, we're actually doing good on time. So this is patient 1. Okay. If someone wants to share what they came up with and what they treated them for. And
I
we'll
called
talk
him
about it.
immediate, and because his perfusion is greater than 2, and depends on what you're getting to. If you have severe bleeding, you'll control that and you'll treat for shock.
Great.
Obviously,
Does
you not lift the fractured leg.
Yeah. And we're not, splinting. We're not doing any of that right now. This is just triage, just tagging them. Okay. Does everyone see that, why this is immediate and what you're treating for?
Mm-hmm.
Okay. Good job. Okay. Patient 2, female teen, breathing, unconscious.
Shock.
Okay. What are they tagged?
Immediate.
Yep. And what other killer could we treat possibly, just to?
She's breathing, she's unconscious, that needs to be.
Right.
Or airway.
Yeah, just making sure the airway stays open. I mean, if you have enough bystanders, you could maybe, make sure that they are, this number 2 is kind of on a hill, so
How about
possibly
shock?
Yeah, I'll treat them for shock.
Yeah, that's what I said.
Yeah.
Yeah,
Thank you,
but
Carol.
you don't want to take too much time here to find something to wrap her in, try and lift her legs to elevate them. You need to get going. You don't
need to get
spend
going.
too much time treating for shock, because that's your only option.
Yeah. And really, and hopefully you have bystanders. You could just say, hey, elevate their legs, keep them warm. Use it, find some blankets in someone's car. You could be giving direction while you're doing this.
You
Yeah,
could
when you come
orient the
back
back.
for the second pass, then you're going to think about shock.
Okay. Okay, so patient 3. So everyone's cool with patient 2. Patient 3, 50-year-old female. No visible trauma. Respiration is greater than 30, and they're speaking incoherently.
That's immediate also.
Yeah, immediate.
Respiration. Okay.
Yeah. And they're speaking, so there's an airway open, they could be sitting down, this I would treat for shock.
Yeah, that's what I said.
Keeping them warm. Yeah. Okay. Patient 4, female, bruising around the eyes, conscious. respiration less than 30, can't follow commands, and perfusion is greater than 2.
It's immediate.
Immediate red,
Yeah,
possible head wound.
possible.
Yeah, you didn't mention the bruising around the eyes. That's what are called battle signs,
Yeah.
where she's had a traumatic brain injury and she's actually leaking spinal fluid. That would cause the bruising underneath the eyes, or they look like raccoon eyes. That's another, or she could have clear liquid leaking from her nose or ears. Her ears.
Yeah.
Can you repeat what causes the bruising around the eyes, please?
It's cerebral. It's basically she's had a brain injury and spinal fluid is leaking out of her brain or out of her cranium, and it would pool around the eyes, causing bruising, or leak out of the ears or nose. It's clear. But if you see somebody who's mentally they're not able to follow commands and they have bruising under the eyes and they've been in the trauma, that's your immediate suspicion is battle signs.
Yeah. So they're tagged immediate. Treatment for this, rapid treatment, keeping them warm.
I do want to reiterate that trauma, the treating for shock would be secondary. You want to get through the triage of everybody first and then come back around and treat for shock.
Okay.
So perfusion is more than 2.
Yeah, perfusion's more than 2. So there's definitely something going on in their, with their blood getting through their body. Okay. Okay, 5 to 7. So female unconscious.
That's immediate.
That's immediate. See, these were trick questions that I didn't even get. Patient 6, male, conscious, quiet.
Don't have anything else to treat them with.
Yeah. It's, to me, it's unknown. I mean, you have your,
you can't get
these are unknown. You're not really able to, you're not to be able to get on the bus to RPM them. Maybe you could talk to them, see if they can follow commands, but you're not going to be able to see about, perfusion, and they're obviously conscious, sitting up.
The way I would do this is if they didn't get off the bus, if they got off the bus, they're walking wounded. If they didn't get off the bus, they're either immediate, delayed, or dead.
Okay.
And if she doesn't fail the test, then she's immediate or dead.
Okay.
Well, if she fails the test, she's dead. I mean, not
Who are
breathing.
you talking about? Patient 5?
Patient 6. So if you can't fail a test on him, then triage him delayed.
Okay.
There's no obvious signs that he's breathing too rapidly, that he can't follow direction, because that's just not in the description. So I would mark him as delayed, but he could
Okay.
be.
All righty. Number 7, calm, communicating that she has no injuries, is able to follow commands. So she's able to talk. So she's passed, the respiration. So because she's communicating, she has no injuries. She's able to follow commands, but you don't know what the perfusion, you don't know, if she has something going on that isn't visible. So, this would probably be delayed also. Yeah.
It has to be because so
What, Carolyn?
you didn't get off the bus when you called for people.
Right. So she's not a
You might
walking
not have been
wounded.
able to get off the bus, could have been an obstruction or something trying to prevent her from getting off, so
Yeah.
you never know.
Yeah.
You don't know what, you just mark it delayed.
I thought you told us she got off the bus.
No.
Just making a suggestion.
She's wishing she would be off the bus, but
And
patient 8, unknown, floating in water face down. I mean, that
Unknown.
would be what?
Dead.
Yeah. Again, I tried to trick you, and I was even tricked because I didn't even count them dead when I did this. So kudos to you guys.
What is
Okay.
number 5, Jackie? What's number 5? What did we tag number 5?
Red.
That's immediate because they're unconscious. Immediate, they fail the
Ball direction.
yeah. Okay.
Thank you.
Yep. Number 9, teen male, unconscious, no visible injuries, not breathing.
Dead.
Yeah.
You would attempt to open their airway if, is this person accessible?
Yes.
Okay, so you would at least attempt to open their airway.
Yep.
If now the interesting question is, if you get their airway open and they regain consciousness and they start talking to you and they're coherent, what are they?
Immediate.
Immediate. Yeah, I would think.
Yes, exactly. Because something happened to stop them from breathing. You don't know what that is. So
Could happen
they're
again.
immediate by definition.
Okay.
So I was
I
going
have
to
a
trick you
question.
on that one.
Tell number 9 again, please.
I have a question. I'm Carol.
Hi,
On
Carol.
on my picture, I don't even see 9. So where is 9?
Right side.
It's right over there by the down power line picture.
Yeah, if you're on your phone, try putting it in landscape. Because I didn't see 1 or 9 to start with either.
No, I'm not on my phone.
I think sometimes they can it split screen, Patrick, sometimes?
No, it just might just not get displayed correctly. She's on the far right. Oh, yeah.
Oh, okay. All right. I don't see it, but I'll go along with what you're saying.
Okay.
Tell number 9 description again.
9?
Unconscious, no visible injuries, not breathing. So that's dead, right?
Yeah.
Dead.
Yeah. Female's 30, pregnant, in middle of heavy labor. No visible injuries or bleeding.
Delayed.
Delayed.
What if her heavy
I would say,
breathing?
I would say
Yeah.
immediate because you
That
don't
would
know
be
what
immediate
condition
on my
the baby is in.
Yeah, but if you're checking respiration, if someone has heavy labor, they're heavy breathing, they could be over
She
30
could also go
breaths.
into shock or something too, possibly.
Right.
But
To
you
me,
don't state in your scenario that she is breathing faster than 30. So therefore,
Right.
you have to presume that she's not, because
Right.
sometimes people are trained and this is their 10th child and they just pop them out easy. So to speak. Pregnancy is not an immediate situation by itself. So you cannot
Right, but
look at pregnancy, you have to look at the RPMs.
Yeah, so
The fact that
It's
she was
not-
outside the bus, wouldn't it, and it said that they were ejected, wouldn't you be concerned about the baby's health and all of that as well?
Right, because she's not just pregnant, she's in labor. This labor
Well,
might
we're
have
not
been
Put into
induced.
labor because of this, you know, that's. could
So
be
we're not
pretty-
diagnosing, we're just triaging under RPMs. So respiration, heavy labor, and I wasn't clear on this, but heavy labor to me means heavy breathing. So so I would think she would be over 30 breaths per minute.
Well, heavy
So-
breathing is also holding your breath. I mean, heavy labor.
Right.
Yeah, and you don't cover it, but I think that it probably should be. If somebody's in labor, they're immediate.
Typically, labor in a
No.
triage class is a trick question for a delayed.
It's a delay. Pregnancy does not equal immediate by itself, even if you are in
No, it's not a pregnancy, it's a labor. And, you know,
labor does not mean
She
well,
could
my
take,
baby
take
wasn't gonna
24
come out.
hours to give
We're all
birth.
gonna die.
She could
Well,
be
you'd
awake
have to
for
take all the
24 hours. You don't
If
know
it's
how long it's going to take her.
Right, if it's immediate, it's immediate, but you know, a lot of people in heavy labor, I'm sorry if it's delayed, but a lot of people in heavy labor need immediate treatment.
Well, if she's in heavy labor, She can be in heavy labor for hours before the baby comes.
Right. Or minutes. I mean, and here's the thing, are you doing her a disservice either, if you, tag her immediate because her breathing may be over 30, or, is she taking up someone else's, the priority in how she's being treated, if you tag her delayed?
If
Right?
the baby is coming, she will tell you. She will know that it's coming. Right.
Right.
And it's normal to be heavy when you're in labor, but that doesn't.
I think in this, to me, it's it's an RPM, but other people may think it's different. So I totally get that.
If the baby picked that moment to go into to start, being born, then it could indicate that there's something amiss, such as the baby may have had like biological functions in the womb, in which case they have to get out quickly.
But this is why we're checking the respirations, perfusion, and mental status. We need to know her respirations here. If it's 31 breaths a minute,
right,
immediate. If it's by definition 28 breaths a minute, she's delayed.
Right.
But that information was not given.
Right.
Right. And this is something where, like I said, you don't necessarily going to take out your watch and start, counting her breaths, whether it's 28 or 29, but I think that that's where you have to kind of use your, what you're seeing, what you're hearing.
If you're saying heavy labor means she's breathing heavily and rapidly, then she's immediate.
Yeah. And that's what I meant to say, is kind of take away the greater than 30, what you're looking for, and just look at her and see that she's in heavy labor, and she's visibly in distress with her breathing.
Well, the treatment here would be to assign a walking wounded to catch and remind them that babies are slippery.
Yeah, exactly.
Don't drop the baby.
Yeah, right. Don't drop the baby.
That's only at the point where she's having the contraction, and when the contraction goes away, she'll go back normally. So you didn't give us information enough to say she's immediate here.
Right, but are you asking her if she's in contraction? I mean, our whole point is triage in 30 seconds or less. So, based on you come upon her and you're trying to get to the next patient. I guess that's what I was trying to get to, is just get everyone to kind of think and look at this, and yeah.
All right, let's move on.
Okay. All righty. Our 11th patient, male teen, standing in canal, severed arm laceration exposing the bone.
Severe arm laceration, not
severe,
severed.
I'm sorry, severe arm laceration exposing the bone. Respiration is less than 30. Perfusion's unknown. Follows command. So the severe arm laceration is, you see how they're kind of situated. I guess it would be the right arm or the left arm, and the other arm is not able to, oops, hi. You're not able to get perfusion, is what I'm trying to get at. You aren't able to have access to that.
All right, but if the laceration is severe enough to expose the bone, you can assume that it's heavy bleeding.
Exactly.
So I would
think so too. Immediate.
I agree with you 100%. It's immediate.
What's making it immediate?
Well, the severe arm laceration.
The bleeding.
Is there blood loss?
If the bone is exposed, it's obviously there would be blood.
Yeah, there's a lot of, yes. Yeah.
Okay. The respiration is greater than 30.
That's less than 30.
Okay, now if he's standing in the exposed bone, he's probably got bacteria in his wound.
Yeah.
But that's not immediate. The only thing that would make it immediate is blood loss.
If he doesn't get treated for that infection, be much more than just
Well,
immediate.
delayed, they're gonna get treated in a few hours.
No, that would not be good for somebody who's got a severe infection.
But remember, we're looking at
Triage, don't worry about the
RPM.
infection.
We are
Let's-
not looking
let's-
at the wound. We're
let's
looking
make
at
this-
respiration, perfusion, and mental status only.
Let's change this and say the perfusion is known. The perfusion is 2 seconds. Now,
He's a
what do we
delay.
tag this person?
Delayed.
It's delayed. It's always been delayed because other people, I mean, you can wrap, somebody can help them wrap the bone, but it's not necessarily immediately death. And you have to take care of the people that can have immediate death, and that would be delayed.
So I would actually
We're
argue. that
we're not
even if-
we're not treating the injury. This is just the RPMs.
So I
Right.
would actually argue that even if respiration is less than 30, even if their perfusion is less than 2 or 2 or less, and they can follow commands, because of the nature of this injury, this person will go into shock.
Yeah.
And this person is immediate.
Yeah,
Okay.
I would take them immediate because it's
Immediate's where I'm at.
if they're delayed right now, soon they will be immediate. I would tag them immediate.
They're also standing in water, so they're subservient to hypothermia with the
Yeah.
weather.
Yeah.
Right, and that's something, we would do on the second round of more intensive or detailed treatment, right?
This is
Okay.
one of the very few ones where I would actually deviate from RPM just because of the nature of the injury.
Right.
The body is going to compensate for that severe laceration in the exposed bone, and it will go into shock.
Right. Well, we have to,
The
I mean,
good
the
thing about
treatment.
number
would be
11 is
controlled.
we know how deep the water is.
Well, that doesn't matter how deep the water is.
Yeah,
You're hopefully going to get him out of the water. If you're
Right.
leaving him in the
Exactly.
water, something's
And-
wrong.
yeah, so the treatment is definitely, we have to control bleeding. I mean, we definitely have to control bleeding on this.
I guess that was my question, was we're not stopping to control bleeding. We were just triaging. That's why I
No,
mentioned,
we have to stop we have to treat the 3 killers when we're doing triage. We have to. That's part of triage.
okay.
Yeah.
Question. Nobody's mentioning minor or green.
Yeah, there are walking wounded. They're all up here. You got them
That was
out.
the 6 others that she
Okay.
mentioned to make it up to 17.
Yeah.
Okay, thank you.
The ones that all of us except for Jackie missed.
Yeah, but I think I missed a couple too, so we're not even looking at what I missed. Okay, so that's the end of my presentation. I encourage you to, to get more information from CERT, Red Cross training, and FEMA. Thank you for attending. You can email questions to me at lafdcertbat5@gmail.com, or that is my phone number. I'm always happy to answer any questions. Does anyone have any questions for me? And this is our social media pages.
I have a question for you.
Sure.
My name is Johnny Grisky. I know I'm on there, but I can't show my face, but thank you for all the good work you did. I'm so proud of you.
Oh, you're so welcome.
No, we need a team. We're gonna make a team. We're gonna make a team together. We're gonna make a big old team, but people speaking up is like, very good job. I'm so proud of you. Thank you very much.
Thank you. Thank you for making it fun. And I hope you laughed at some of my memes because I had fun making it.
Excuse me, could I just,
Yes.
could I ask you to explain again what per cap means?
What is
Per cap?
cap refill?
Oh, yes.
Cap refill is your capillary refill. Okay, so when you press on your finger,
Can you de-share and maybe demonstrate?
Fingernail, to be clear.
yeah, the tip of your finger. Let me get to. Okay, so you're gonna press on the tip of your finger. Okay, And when you release, it fills back with blood. That's your capillary refill. The capillaries are right at the surface there, and it should go back to normal within 2 seconds. That means you have normal blood flow. If you can't do it on there, you do it here. You see how that comes back? You see how fast that comes back? So if it's over 2 seconds, there's something going on internally, right?
Inside the body, you're losing blood someplace.
So
Right.
Hey,
That would be-
Jackie, to be clear, are you talking about the fingernail bed or the tip of the finger?
The fingernail bed,
Right.
but also the tip.
Yeah, either
What
one.
happens there? The same one. I mean, it really, if they're wearing fingernail polish.
Yeah, or you could use the inside of the finger. nail
Yeah. Yeah. So you can look at the bed. I think the bed just shows it more clearly to me. You can really see the white, and then the white fill with blood. The white, it gets white when you press it, and then it goes back to normal. But this on here, you can really see that difference, right?
Okay.
Yeah, you can't see that on my hand.
You can't. Well, you would. So how would you determine that, Miss Carolyn?
The fingertip on the inside. On my hand,
Right.
you can't see that. I have a dark hand. It just doesn't do it as easily.
Even on the palm of your hand, where you have more surface area?
Yeah, I'm doing it right now. It's just not. It's not enough contrast to tell.
Okay.
But the inside of my finger, the nail bed, or right the tip on the inside, you can do it, and it'll.
Okay. Okay.
That's something to consider when it's the person's complexion may make a difference.
Okay. Does anyone have any questions?
What was the final decision on the last patient, number 11?
Immediate. Let's see. Yeah. Can everyone see that? Yeah, it's immediate because that arm laceration, they may be able to follow commands, and their perfusion is, you were able to determine it was under 2 seconds. But with a wound like that, I think they're gonna go fast downhill. They're gonna go downhill fast, and they're gonna change from, they're gonna go into immediate sooner rather than later. Does that make sense?
Yes, thank you.
Okay.
This is Carol. Can I see the numbers that you had up for CERT? And I think you had Red Cross. I didn't get those numbers.
Oh, sure.
I mean, the emails. Oh, that was it. Yes. Thank you.
Yeah.
I'm sorry, Jackie, can you just tell me again, what was the tagging on patient number 8?
Dead.
Dead, and number 9 was dead also, unless
Correct.
he refreshed himself when we tried his airway, right?
Yeah, he didn't refresh himself. Yeah, he's dead also.
Okay, so there were 2 dead. Okay.
Yeah.
Thank you.
You're welcome.
Jackie, can I get the capillary refill test, but explain perfusion greater than or less than 2? And it's just that 2 seconds on the capillary refill?
It is. That's what you're testing on your RPMs, your perfusion, to see if the blood flow is there. There's not something going on inside,
right?
That is preventing it from refilling. Okay, from your circulation to actually be working normally.
So if they have internal injuries and they're bleeding internally, it won't refill.
Yeah, I mean, something's going on, right?
Yep.
Yeah.
All right, so this Saturday, December 18th, again, is our drill in Northeast LA at the Rose Hills Recreation Center. You can go to our website you can bring up our calendar at calendar.ntp-la.org, and I'll put it in the chat. to find the Eventbrite and information about that. It's going to be from 9:30 to 12:30. And I encourage everybody, because we're going to be in person and actually doing these kinds of exercises and going over this kind of information. So hopefully you can attend. Again, that calendar is going to have all of our upcoming events. And January we'll be in the harbor for our in-person drill, Coastal San Pedro. And I'd like to get a round of applause for Jackie.
Yay.
Yes, Jackie.
You guys were so great.
No,
Thank you.
we're so proud of. We need people you to speak up. Very good presentation that you made. Thank you very much.
Thank you. Thank you.
Jackie. It was
Question
great.
for Patrick, please.
Thank you.
You guys are awesome. Thank
Hold
you
on,
very
I
much.
want to say something to Patrick. Are you still there?
Yeah.
I will be there on Saturday.
Great,
Let's
Ronnie.
make things happen.
Please.
All right.
And the community of El Sereno. Thank you very much, Patrick. And you, very good job you did. I'm so proud of you.